Hi guys, in today's video we are going to be talking about nursing management, how to write nursing management. So we are going to be making use of this acronym, APOIS DESERA. A stands for admission, and in this admission now, this is where you are going to tell us, how you are going to admit the patient. You have to admit the patient in a calm, noise-free, conducive, well ventilated environment. And assessment, you are going to now check the vital signs or any other assessment you have to do. You have to do examination, that is physical examination and all that. P stands for positioning. You're going to position this patient well. If it's a patient with a cardiac problem, you have to put the patient in upright position. So you have to tell us the particular position you have to put the patient according to the disease condition that you are managing the patient. P stands for physical care. In this physical care, this is where you are going to take care of the patient physically, the oral care, bed bathing and everything. This physical care is kind of similar to comfort. So you are going to take care of the patient physically. The next P stands for psychological care. You're going to reassure the patient. You are going to be there for the patient, because in nursing you manage the patient holistically. O stands for observation. In this observation, that is where you are going to observe things about the patient, the gaits, the way the patient walks, the way the patient talks. If it's a patient with mental problem, in this observation, that is when you are going to observe the patient, if the patient is oriented or disoriented. In I, this is where you will now tell us the investigation you carry out, maybe the blood test, the sugar level, so on and so forth. It is for laboratory tests. Those investigation you carried out. Stands for diet and drug. Here you are going to tell us the type of diet you are going to give this patient, if it's glucose free diet or drugs, the drugs you give the patient. This is where you are going to tell us the drugs you will give. E stands for elimination. Here is when you are going to chart the intake and the outputs, everything the patient tests, like water, drips, everything. This is where you are going to, and the urine, blood and body weight. This is where you are going to tell us about it. Sina is comfort. This is where you talk about the oral care, sponging, bed beating, everything to keep the patient comfortable, changing of the patient clothes, position. And in positioning now, you talk about maybe turning of the patient to, if the patient needs on you. E stands for exercise. If it's a patient that can walk around, the patient can do active exercise. But if it's a patient that do not have strength, or unconscious patient now, in passive exercise, all these minor exercise that nurse is going to, stretch the leg gradually, small, 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 small. While active exercise is the one the patient is going to do if the patient is very strong and able to do it. So now, this is where you are going to talk extensively about rest. Here you will now see restriction of visitors, just for the patient to rest. In S now is special care. Any disease condition that has special care, here now is where you are going to tell us about it. And another R again now we have here is rehabilitation. Rehabilitation, any disease condition now that demand rehabilitation, for the patient to be rehabilitated, like all mental health issues, you have to rehabilitate them. You have to, empower them, make them, to be able to perform all the activities of daily living, all the things that they have been doing before. You have to help them. That is R now stands for rehabilitation. Anything peculiar, any care peculiar to the disease condition, you have to, perform. In this special care, you are going to tell us. Advice on discharge. These are the things you are going to tell the patient. If the patient wants to leave the hospital after discharge, you will tell the patient to take his or her drug first. Secondly, you are going to tell the patient that even when she gets well, she should continue, she should continue taking the drugs. The third one now is, if she notice anything that is abnormal before the day of follow up, the day she is out to visit the hospital, that she can come. And maybe the next one now can be to remember our follow-up dates that she's going to come for re-examination. So I hope with this explanation you've understood how to write nursing management.